Thanks, Trudy, for that good introduction. Yeah, this is shockwave therapy is something I'm sure that most braille racers are familiar with. If they haven't used it on their own horse, I'm sure they've heard of friends that have used it. And it's something in our practice that we use every day, often multiple times a day. And really, the more we use it, the more uses we find for it. So there's still emerging things that we're just now even discovering for the first time that this can be really beneficial for. And we'll talk about a few of those things today. So just exactly what is shockwave therapy? I think sometimes the word shock in there can be confusing, thinking maybe there's an electrical pulse going through. That's part of the treatment. That's not the case. So what it is it's just a high energy pressure wave. It's basically a really intense sound wave, an acoustic wave that's in alternating intensities. And so if you look at the little diagram over here, oftentimes we think of waves as like a wave in the ocean, kind of the up and down waves. And that's how light's transmitted. You can see in the diagram, right here that we can kind of see these up and down waves. Well, the pressure waves are a little different from that. They're like compression and expansion. So that's kind of how you can think of these type waves as they travel through tissues, and also how just sound travels through air. And that's how it vibrates your eardrum. That's how you hear things, is those waves compress your eardrums and they vibrate. So kind of a similar type process with a shock wave. They're very rapid high pressure, so you get this really big pressure, and then you'll get kind of a negative pressure afterwards. So there's this expansion and contraction is how it has effects on tissues, and we call that mechanotransduction. That's a long word. Basically, just that's what's happening in those tissues as things are moving through. We'll kind of give you a little diagram of that here, of what's happening in there. So in this diagram here, you can see over to the right, we have this kind of simulated shockwave trode right here, and that trode's traveling through the tissues. What are in these tissues? Well, we have cells, which you can see here, various types of cells. We have blood vessels, and then we have what's called the ECM, or the extracellular matrix, which is basically like everything around the cells. It's a pretty simplified version. Obviously, there's lots of little things other than that, but these are the big components. And so what happens when these shock waves travel through the tissues are they start to compress these cells and compress the vessels and compress the ECM. And they compress them down. They also have some shear forces kind of moving them back and forth. And what that does is when the shock waves, like say it's this cell wall right here, that's called an area of impedance, because you're getting changing densities in the tissue, and it releases a lot of energy right at those surfaces. And what that does is it stimulates those cells to release growth factors and cytokines and different proteins that can have a lot of functions. Some of those functions are decreasing inflammation, improving healing, and we'll go over those here in a second as well. But that's kind of in a real simplified way, what the shock waves are doing, how it works, and then what's it doing in those tissues and how it has its effect, basically through releasing all these kind of innate mechanisms that the body already has, but that aren't being triggered. So it's kind of, you can think of it as kind of telling some of the genes in that area to decrease inflammation or to send things here to heal this area. And so kind of four of the big things that we think about that shockwave does is it increases local blood flow. So there's a fancy word for that called angiogenesis, which means stimulating blood flow, stimulating blood vessels in that area. It also stimulates the innate healing mechanisms. We talked about that. So some of those things are growth factors and cytokines that we're stimulating in those tissues. It also decreases inflammation. That can be a byproduct of some of those growth factors that we're releasing. There's also a pretty significant pain reduction, which can happen two ways. One is just kind of get this immediate pain reduction from the stimulus, the shock wave. Then we also get more long-term due to the decrease in inflammation and also some of those local things that are getting released in that area. So just kind of as a little synopsis of some things that are important to remember here is that there are different devices out there that claim to be shockwave, and some of them really aren't shockwave. Shockwave, it is a medical device, so it's something that should be used by a trained veterinarian, a trained professional. It's not something that should just be used by a non-veterinarian saying, okay, let's treat this with a shockwave machine. And the high quality medical devices that are the best ones to use are only going to be sold to a veterinarian anyway. We can often do this without sedation. It is very safe to do this. You know, there's a high safety threshold in the right hands, knowing the right way to use it. You know, we will sedate some horses down their legs. Sometimes they move a lot, and we just want to be still. So lots of times we'll sedate them for that reason. But a lot of horses are very tolerant of this, even without sedation. It can have very long-lasting effects. Sometimes just after 1 or 2 treatments. It's not like it's something that we're having to do, you know, once a month, typically on these horses. And there's several factors that we think about on shockwave. And this is just to kind of demonstrate why you want somebody that knows what they're doing to use this machine, because we have a frequency. So that's basically how fast those shocks are going. So that's kind of setting that pause period that we talked about, where you get expansion and contraction. It kind of looks at the speed of that. We have a power setting also. It's just the power of the shock going through. We have different trodes that we use for different areas that penetrate different depths. And also we look at the number of shocks in each area. So you really want to, you know, somebody that's administering shockwave therapy, they have to consider all these factors to decide, you know, what settings do we want to use for what we're treating. As I mentioned, there's our different shockwaves out there. I'll go through every detail on here, but kind of just to get a visual, the PulseVet is an electrohydraulic. It's sold to veterinarians only. It has the highest peak pressure, so it's going to get the most power and the largest area treated. You can see these little orange areas here, just kind of as a visual demonstration of the focal area that you would treat. All settings for this are true shockwave. They're also electromagnetic and piezoelectric. Both of these can be true shockwave at their highest settings, but even at their highest settings, they're going to be much lower, you know, often about 1/3 of the energy that you're going to get from an electrohydraulic like PulseVet. There are also some radial pressure machines out there. These are like a pneumatic jackhammer, so just kind of like pounds it. These are not shockwaves. These are often sold to non-veterinarians, and so these are actually not a shockwave. It's more like a massage in a lot of cases. So what are the common things we use? Now, this is certainly not an exhaustive list, but these are kind of the big things that we think about using shockwave for in practice. So healing of soft tissues, which can be tendons, ligaments, really any soft tissue, shockwave has the potential to help. I put suspensories in a separate category because they are a soft tissue, but I kind of feel like they're a category of their own, especially when we talk about shockwave therapy, and we'll go over that some. It can be effective for treating arthritis in multiple areas in the body. We often use it for neck, back, and SI pain as well. Also for kissing spines. Again, I know kissing spines are part of the back, but I put them separately, and we'll go over that as well. It can be helpful for treating horses with navicular pain, depending on what that pain is caused by. And also one of the big things is for bone healing. So we're talking about horses that might have fractures, have buck shins, things like that. It can be very effective. It's been shown in multiple studies to speed bone healing. So when we think about soft tissue injury, again, we think about tendons and ligaments. Typically, when we're treating these with shockwave, typically we'll do about 3 treatments, anywhere from 1 to 2 weeks apart. We often combine these with the regenerative therapy. So I use a lot of PRP. Also use a lot of amnion product called Regeniflex. And we'll almost always combine the two at the same time. So if we do PRP, we'll inject the PRP. You can see here, this horse has a large hole in the suspensory. That's what this black area is here. So we'll take some PRP or Regeniflex, inject it directly into that hole. And then with PRP, we shockwave it after, because there's been some studies that show that shockwave after PRP helps activate the PRP and potentially make it more effective. So we'll often do that. With all other products, we'll shockwave first and then do the injection. I included soft tissue apparatus in this just because there's a lot of soft tissues. I know the navicular bone is a bone, but there's a lot of soft tissues around it that we'll sometimes use shockwave to treat, like bursitis, which is just inflammation of the bursa. I actually had a case a couple of years ago that had been treated for 6 months by some other veterinarians. The horse really didn't get sound. We did an MRI, and the horse had navicular bursitis. That was the only thing on the MRI that was really significant. So I injected the navicular bursa, and the horse didn't really get that much better. So we ended up just really almost out of desperation, shockwave the horse to the foot, and the horse went completely sound and stayed sound. We didn't have to do it. I think we did 3 treatments, but after the 3 treatments, we didn't have to treat the horse again. So there's certainly an indication in some navicular cases to use it. Again, I said that suspensory is kind of their own thing. And high limb suspensories are different from front limb suspensories. Obviously, if you've been around barrel horses very long, this is one of the bad S words. It can certainly be scary to have a horse with this, and it's very, very common in barrel horses and very common in other disciplines. Well, we see it a lot in our jumpers, our dressage horses, a lot of Western performance horses. So it's probably one of the most common soft tissue injuries we see. There was a study done. I thought this was pretty interesting, that shockwave therapy was 3.8 times more likely to return to work 1 year later than just PRP alone. So they had a group of horses that only shockwave and a group that they only injected with PRP. And the shockwave group were almost 4 times more likely to return to work after 1 year. Now the PRP group, on really severe cases, those really severe suspensories showed some better improvement with PRP, but on average of the whole cases, shockwaves was 4 times more likely. Now, oftentimes we'll combine the two, like I mentioned. I think that's probably ideal in a lot of cases, is to use both of them. Really, shockwave is my go-to treatment for suspensories. So we have a suspensory that's mild to moderate with no holes in it. Then we'll typically do 3 shockwaves on it about 2 weeks apart. And oftentimes after your third shockwave, a lot of those horses, after a short period to bring them back, are good to go as long as it wasn't a severe injury. So we really see good results with shockwave therapy, especially upper parts of the suspensory ligament, to get those things to heal and get those horses back in work. Osteoarthritis. So at least personally, the biggest use I use it for is for hock arthritis, especially in those cases where we're getting those horses that are starting to fuse. It's getting more severe. Those horses are not responding to hock injections anymore, or sometimes you just can't get the needle in there to even inject it. Now, there's a lot of other things we can use on those, but I've often found that shockwave therapy can be one of the most effective things we can use on these horses. I've got some horses where it lasts a long time. Like I've got some that will shockwave them maybe twice or sometimes 3 times, and we might get there's some cases I'll get up to a year from that, which I don't really understand why it lasts that long, but sometimes it has. And so I think this can be a good option for some of those horses that have more severe arthritis that are not responding to joint injections. We also use it in horses that are getting drug tested. So like say you've got your horses that are English sport horses that are going to get tested. We use shockwave a lot on those, like pre-competition, to help them get through and not have to worry about getting a positive test on a drug test. It can be used in other joints as well. I've also used it in pastern joints, kind of similar, because those are prone to fusing. And so horses with the term ring bone, that I'll use it in ring bone cases. It can be used in fetlock, stifles. There's a lot of joints you can use it in, and it can be effective in all those. I'd say the most common joint I use it in is in the hock, especially in a barrel racing horse. Kissing spines. So this is another kind of dirty word. I know that there's been a lot of attention to kissing spines in the last probably 5 or 6 years. It certainly does or can get overdiagnosed in some cases, because probably around 40% of horses have kissing spines, and certainly not all those it bothers. And so that can be a difficult thing sometimes to tell if it's actually the problem or not. But one thing that kind of changed my view on how I treat those, I used to almost inject all of them with steroids for the most part. There's a study done by Tracy Turner, and what he looked at 212 horses that over several years' time. These were English sport horses for the most part, so there probably weren't very many barrel racing horses in this study. But kissing spines is kissing spines. They treated part of the horses with shockwave therapy. SWT is shockwave therapy plus mesotherapy. So mesotherapy is where you take these little intradermal injections you do along their back that kind of blocks some of the nerve pain. So the combination of those two versus steroid injections, it was more than 30% more effective. And they used it's 86% of a favorable outcome. So I think they looked at horses going back to work, not being in pain. They had several things they looked at, but basically the shockwave therapy and mesotherapy was far superior to steroid injections for treating kissing spines. And that really changed how I started to treat these cases, and certainly started using shockwave therapy and mesotherapy much more on kissing spines after I read this study several years ago. So this is emerging cases. This is kind of an exciting thing for me. We started working on this a little over a year ago, looking at bleeders. So EIPH, that I know the common term is bleeders. Exercise-induced pulmonary hemorrhage is the scientific term. And now we're starting to look also at equine asthma. And we'll go over some of this because I think this is really interesting and certainly pertinent to the barrel racing community. I want to go a little bit over EIPH, and so y'all can understand like what's happening in the lungs. I know that term gets used a lot, but you may not understand all the dynamics going on, which I think helps us understand like what things are effective and what things aren't. So when a horse is running at full speed, their heart's beating 4 times per second. So that makes really high pressures inside the capillaries. So these little tiny vessels in the lungs, they've only got a half of a micron, which is less than a paper thickness thick. They're so thin because it allows oxygen to go in and CO2 to go out efficiently so they can run as fast as they can. And so it's a really great mechanism to help them breathe better when they run, but it also makes them vulnerable to getting little cracks in those vessels and blood coming out. So we have this super high pressure on the inside pushing. At the same time that horse is running, it's breathing in 4 gallons of air per minute. That creates super high pressures on outside of those walls here. So you got the pulling from the outside, you got pushing from the inside. So anything that we're going to do to help improve bleeders is going to have to affect one of those two things. Either the pressure is pushing on it or the pressure is pulling on it. So how do we do anything about it at all? Well, we can minimize airway obstruction. So basically that just means we're decreasing these negative pressures by helping the horse breathe better and open up the airways. Or we can decrease the circulating blood volume, which is basically just decreasing the pressures pushing here. So what ways we can minimize air obstruction? Well, one way is a flare strip. I don't have any affiliation with them, but they have 6 or 7 pretty good studies off the racetrack in Florida showing it can be effective. In racehorses, it has been shown to help with race earnings over time on horses that are bleeding, to help decrease bleeding. So I do believe there is a place for flare strips, certainly in controlling EIPH. I think one of the biggest ones that we see is minimizing mucus and bronchospasm. MEA just stands for mild to moderate equine asthma. So that causes mucus production in the trachea, which decreases the amount of air that can pull through there. It also causes inflammation in the bronchioles, these little sacs in the lungs, and it makes them constrict. And when they constrict, then the air can't flow through them as well. So those things can both cause increased pressures in the lungs. And then we can correct laryngeal dysfunction. So if a horse has a paralyzed flapper, which is a term y'all probably heard before, we can fix that, help open their airways up as well. Other way we can help them is to decrease blood volume, and that's furosemide. If you don't know what furosemide is, that's Lasix. So, we give them 3 or so cc's of Lasix a couple hours before they run. They urinate, decrease their blood volume, that decreases the pressures in the lungs and makes them bleed. The only two, or makes them bleed less, or not at all. The only 2 things that have been shown thus far, at least if we look at all the scientific studies that have been performed to decrease EIPH, are Lasix and flare strips. There's been studies done on Kentucky Red, on all these other products, and none of them have shown that they make a difference. And in my opinion, about the only way to really treat them is to treat, I think a lot of these barrel racing horses, or most of them that are really bad bleeders, are bleeding because they have asthma. And so I think if we don't address the asthma in the majority of our barrel racing horses, we're going to have trouble controlling the bleeding. Just a quick background on it. It wasn't something that I came up with. My first introduction was from the Standardbred Racetrack in Florida by Dr. Martin Allen. He was reporting that he was getting resolution, or at least a decrease in bleeding on the horses that he treated. In a lot of cases, he was able to stop using Lasix, or at least reducing the amount of Lasix he was using on those horses. I'd heard years ago that if you shockwave lungs, then it can be dangerous because the amount of pressure that gets released at the lungs from the shockwave could do damage to the lungs. There was a study done at the University of Cordoba that showed that where they put the trode like on just one place in the lung and just hit it, bam, 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 with 1,000 to 3,000 shocks in one place. Normally we're moving it, so that's going to be even more focal in one area, and at the highest energy setting, which is E8. And so they did histopathology on those horses, And what they found, basically, they just did an necropsy, took the samples of the tissues, looked at them under a microscope, and all they had was mild hyperemia, so just mild increased blood flow in the area of the pleura where the shockwave was performed. So, based on that, looks pretty safe. So far, I've treated probably 60. I've done probably 60 treatments at this point of lungs, shockwaving lungs. Haven't had a single horse with any symptoms. So I feel really comfortable with it at this point that we're not causing any damage. What we've been doing is we've been treating these horses 24 to 48 hours after they race, after a bleeding episode, for at least for the portion of this that I'm talking about that we're trying to address the bleeders. We're treating the back half of the lungs on both sides. We're doing 750 shocks each side. You can kind of see there, we're just kind of going up and down right over the lungs. Actually, ultrasound them first, and I mark the area of where the lungs that we want to treat, and kind of trace it, and then we put lube in that area, and then we're treating that area. What we found so far is we've had 83% of the horses that improved at least one grade on our bleeding scale, and I'll show you what that scale looks like here in a second. 53% of the horses had improvement of 2 or more grades. All the horses in the study had asthma. So that's because we're doing BALs on these horses where we pass a tube down in their lungs, we put saline in there, we draw it back out, and then we send it off to be analyzed to look at the cells that are in it. And every single horse has had asthma, which has been, I guess not surprising, but expected, I guess. 65% of the horses that got better also improved on their neutrophils. So neutrophils are an inflammatory cell that are inside the lungs that we look at to assess if the horses have asthma. When those are increased, that's an indication of asthma. And so 65% of the horses improved at least 6%, which is a pretty big improvement on the neutrophil count. So that made us start thinking about, well, I think, what if we're treating the asthma, and by treating the asthma, we're making the horses bleed less. I just want to let you see here what this scale looks like. So it can be shocking, I think, when we do some of these BALs. You can see on the far right, this is the fluid we pulled out of the lungs. It's like pure blood. And so, we'll get all these different ranges of amounts of blood you can see here. Typically, these, like, say this grade 1 here, where it's just mild, those horses typically, even if they're bleeding a little bit, that does not typically bother them or affect their runs. It's when we're getting these higher grades, like a grade 3 or grade 4, where you're really going to see that start to affect the horse's ability to perform. So in summary, for the bleeder study that we've been doing, certainly the improvement that we've been seeing has been correlated with asthma. So when the horse's asthma gets better, the bleeding gets better. In the study, we have not been treating for asthma. We've only been shock waving them. And if they weren't on Lasix, if the horses weren't being given Lasix before the study, like the run before the study, then they couldn't be given Lasix until the study was over. But if they were already on Lasix, they could stay on it. We're still trying to figure out the best protocol. I'm sure over time we're gonna develop that. Basically, we're treating the horses twice at this point. Once right after a run, and then 2 to 3 weeks later after their next run, we're treating them again. And the newer bleeders have been responding better than the ones that have been bleeding for a long time. Certainly, we've had some chronic bleeders get better, but the ones that they've only bled once or twice before, those horses are responding even better than the ones that have been chronic. All right, so just as a summary, most common use cases, especially in barrel horses, are for suspensories, kissing spines, injuries, like any kind of soft tissue injuries, deep flexor, all those things down the legs that we treat that get injured. Certainly use those daily for that. And then for me also, from an arthritis standpoint, hock arthritis. And in the emerging use cases, we have bleeders that we talked about. And then we also have asthma. And we're working on a study right now that looks very promising. We're shockwaving horses that are coughing and then seeing how they respond to how it improves their coughing after they're treated with the lungs with the shockwave treatment. And so we're just starting that study, but so far it does look promising. And again, I think most of our bleeders in barrel racing are linked to asthma. So if you've got a bleeder, get a BAL if you can on that horse. I encourage you to really look at the asthma component. They don't have to be coughing to have asthma. And so I think that's a big component in our bleeders. And I think most bleeders, we need to treat the bleeders by treating the asthma.